In this clip, we see Tylonia McGinister, a 24-year-old woman involved in a rollover crash. Though restrained during the collision and never ejected from the vehicle, the violent forces of the accident were enough to leave her drifting in and out of consciousness during transport. By the time she arrives at the hospital, she is awake and alert, watching the room around her as the trauma team takes over. Doctors and nurses immediately begin a standard trauma assessment. A cervical collar remains firmly in place to protect against a potential spinal injury. Oxygen and monitoring equipment stay connected while the team rapidly evaluates Tylonia's airway, breathing, circulation, and neurological status. No major trauma is found in her arms or legs, and no serious injuries were reported. One noticeable detail with Tylonia comes after her primary assessment. When she first arrives in the emergency room, her body is fully covered. After her assessment, a medical worker adjusts the sheet covering Tylonia, eventually draping it over her legs and tucking it between her feet, leaving them uncovered. Exposing feet briefly is usually acceptable in a stable patient, allowing easy observation of color, circulation, spontaneous movement, and neurologic symmetry without repeatedly lifting sheets. Tylonia remained remarkably still. Her feet remain in a relaxed, outward resting posture while she lies supine on the stretcher. Trauma specialists would view this as a normal, non-guarded position for a patient under spinal precautions. From the visible angles in the footage, her feet appear externally rotated at roughly 20 to 30 degrees from midline, well within normal resting parameters for someone lying flat and instructed to remain still. Based on the available footage, Tylonia appears to stand approximately 5 feet 7 inches tall, consistent with her overall body proportions relative to the stretcher. Her feet appear proportionate to her height and frame, suggesting an estimated shoe size of 9 to 10.